Welcome, everybody. I'm Joel Morgan, the pastor of Westminster Presbyterian Church, and I'm really happy to be here with you today, but especially happy to be with Anthony Grimes, who is the founder of the VARR Foundation, which is a nonprofit that runs a number of recovery residences here in the Richmond area. But part of the reason for the conversation today is he's also the executive director of the Virginia Association of Recovery Residences. And so that's part of what I want to talk with Anthony about today. So Anthony, I'm really glad that you're here.
Thanks for having me here, Joel. It's an honor and a privilege, to be affiliated with Westminster Presbyterian Church. You guys have opened up the doors to allow us to have the VARR offices located here in your facility, and you've supported us, and it's been a great partnership, and we really appreciate that.
Yeah. Well, so why don't we just go right there? Why don't you tell us a little bit about what VARR is and what VARR is trying to do?
Sure. So VARR is the Virginia Association of Recovery Residences. We are the state affiliate of the national organization, which is NAR, which is the National Alliance for Recovery Residences. And what NAR does is they set, monitor, and evaluate standards centered around recovery residences. And to this date, they are the only nationally accredited set of standards that has been adopted in legislation in many other states. And in 2019, the state of Virginia put forth House Bill 2045, which called for a certification of recovery residences by the Department of Behavioral Health and Developmental Services, which is our single state agency. And in naming them, the Department of Behavioral Health and Developmental Services named VARR as the credentialing entity for their state certification. So that gave us some teeth behind what we're doing, and it also it really incurred an uptick in membership. And so what we do at VARR is we go around to every corner of the Commonwealth of Virginia, and we certify recovery residences by those national standards. And we vet all their documentation, we check their insurance, their policy, their procedure, how they do things, make sure that they use a universal grievance procedure that gives residents the right to contact us directly if there's any type of mistreatment. And what it also does is it brings about a unified body centered around recovery residences. It helps us to come together to benefit the people that we care the most about. And that's the people that we're serving, the people with substance use disorder seeking a safe, certified recovery residence.
Yeah, so it really is about making sure that the care and the program those folks are receiving is done in a way that is appropriate and not abusive and not manipulative of them, and to make it so that the like you say, the mission is serving those folks and helping them live their recovery. Yeah,
Absolutely. Recovery residences have been looked at, previously as kind of like the Wild Wild West, like they're not licensed facilities because they're not clinical, and they're not licensed by, DBHDS or some type of behavioral health authority. And that was really the reason that NAR was formed. It's peer-to-peer, it's people with lived experience, helping people who are newer than themselves. And it calls for a certain number of community inclusion, which is, a big reason why me and you are sitting here today.
Yeah. So tell me a little bit about that. How do you see, in terms of recovery residences and all that, how do you see community partnerships being important with recovery residences?
Well, they're key. We are very, very fortunate here in the Richmond metropolitan area that we have some great community partnerships. Obviously, VARR is partnered with DBHDS for this certification as a credentialing entity, which has opened up some avenues for some grants and a little bit of funding to help people who are indigent. And then when you level down from that, you have recovery residences that have built good relationships with certain doctors and mental health professionals and counselors and therapists who they are able to connect residents to meet some of the barriers to their recovery. And then when you go down deeper than that, there's organizations and groups and churches such as Westminster, who have gone a step further. They've decided that we're not going to be one of these groups of people that expect somebody else to help those people. How we live in a world that is still stigmatized by addiction. And what Westminster has done is they have made it one of their missions to open up their doors and welcome those people in. And we've seen it happen with some other nonprofits in the area, who may not have anybody who's in recovery actually affiliated with that organization, but yet they've made it their mission to connect to the recovery people and ask, how can we help? What can we do? Not what can somebody else do, or we'll leave it for that person to do, but how can we help? And when we get that type of attitude coming from community and from partnerships and people who are stepping up, what happens is that the people that we're trying to serve and that benefit the most are the people who need it the most. Those are people who are early in recovery, people with substance use disorder, people returning home from incarceration. And if you look at the numbers, history will tell you that that's the most underserved population in this country.
Think about, of course, the imperative of people who follow Jesus, right? Is like, to serve the least of these, to be alongside of, not to lord over people who are on the margins, but to come alongside of them and walk alongside of them. And that's how I think about as pastor of this church, and then as connected with you and with our recovery center and with people in recovery, is that we're not coming in as people who think we know better. We're coming in as community partners, walking alongside of people and hopefully showing them that we're people just like they are. We want the same things that they want, and that we care for them, even though they may think other people don't, or they may actually think that church people could really care less about them because of the stereotypes and maybe even the way they were living their lives, which wasn't healthy for them, wasn't healthy for the community. And I just say, one of the things I talk about here a lot is when Abraham was called to go become the father of this great nation that would become Israel, that his call, it was not so that his progeny, his children, could just be this city on a hill. It was so that they could bless all the nations. And that's what I think about for us as a congregation, is I feel like every day, if we're doing what we're supposed to be doing, we are seeking to bless the whole community. And that's where I think our work with VARR and our work with the Recovery Center and our work in that area, as well as a couple of other areas where I feel like we're actually living into this mission that we're supposed to be about. And it's not easy, as you well know. You've shared statistics, and you're especially being the executive director, but also being somebody who runs recovery residences. Overdoses are up tremendously this year because of COVID and all that. So this is not easy work on your part or on our part, to see people that we meet and get to know, and then see them fall off and maybe die because of their drug use. So, well, if there was something that you could ask of Westminster, or you could ask of the larger community,
what Westminster is already doing is part of what my ask would be. And that would be to let the people who recovery residences are serving, this underserved population, that somebody cares. We don't care what you've done previously. We don't care what your age is, what your race is, what your sexual identity is, whether you're religious or not religious. That doesn't matter to us. You're a human being who's been through a struggle, and we want to help you persevere. Westminster sponsored one of the recovery residences that the WARR Foundation operates. And even during COVID, the relationship started kind of at the beginning of COVID, where they said, we're going to sponsor this house. We're going to help the men. It's a men's house. And our first introduction was when they, some members of this congregation gave us some furniture and some things from a warehouse that they had. And, we said, man, that is so powerful. Thank you so much. Well, then we began to receive email after email about, well, what else? See, that's the type of attitude. It's not just here's a little something and go away. No, we want to be involved. And what we've seen is that even during COVID, right? Even during COVID, one of the members of this congregation, it had to have been 20 pounds of coffee, Joel. I don't know where he got this coffee from.
Yeah.
And anybody who knows anything about recovery or 12-step meetings, like, coffee's one of the key ingredients in that world, right? And this member brought these bags and bags of coffee, right? So as me and you are sitting here talking today, right, there's a resident in a recovery residence who's drinking that coffee that was supplied by a member of Westminster Presbyterian that knows that, you know what, I couldn't afford any coffee, but we got this donation from some people that I don't know, but what I know is by this simple gesture that they care.
And that's great, Anthony. It's beautiful. Anthony, it's been great to be with you today. Thanks for being here.
Pastor Joel, we really appreciate you having all of the wonderful recovery resources you have in this facility. We are so grateful that this church has been a beacon of hope for people in recovery by serving the 12-step community for, by my account, almost 40 years. And you continue to raise the bar and want to know how this congregation and this church can do more. And I just can't tell you what that means to us. And thank you for having me here with you today.